And good evening to everyone on the line. This is Dr. Dale, and I'm so happy to be with you this evening. Our presentation is on bone density, and a presentation that I gave this year recently to the International and American Association of Applied Clinical Nutrition. We were talking about, and they asked me to present something on structure and the causes of structural issues and bone density. So I'm going to give you the whole thing tonight. I think you're going to really like it. And then if the recording actually turns out good, sometimes they don't, then that will be available for you. So we need to talk about the causes of structural issues. A lot of people are not aware of this, and most people don't even go into this, but you can change anything because everything is living in your body. So we want to talk about the causes of structural issues, including bone density. And these would be nutrients, deficient in certain nutrients, and to have a solution for this, part of it would be nutritional, of course, minerals, hormones that need to be balanced in the body using natural methods, and in other words, healing the body so that it produces its own hormones. And then we were going to talk about a protocol for assessing the cause of structural issues through employing and integrating 3 different testing methods and testing and things you can do. Now, we also want to look at the investigation of patients' historical data and current symptomology. So you really have to investigate so much data from the patient. Sometimes simple things can be overlooked because they don't tell you. So you want to determine the location and cause, okay? And if there's a structural issue, when did it start? Is it genetic? Was there an accident before or after it? Was there drug use before or after it? Was there alcohol use? What kind of addictions were there, if any? And also just all different kinds of things about movement and what kind of conditions did your grandmother have, did your mother have, etc. So we want to detoxify the body. It's very important to detoxify so that we can actually strengthen the bone density. And to do that, we need to use clean products like the Slow Cleanse or the Whole Body Deep Cleanse. For bones, I would suggest the Slow Cleanse. And also we have to monitor the detoxification process after a month, do 1 month at a time, and then you can test the patient to determine if they need to go for a longer period of time on the Slow Cleanse. Sometimes 3 months is the key. Eliminating any and all causative memories of historical traumatic events. Now, all of these memories of historical traumatic events, even as a child, get stuck in the bones. The bones are living, okay? The bones have a matrix, okay? And so we need to get our body balanced, and if there are causative memories, if they have any severe trauma from their childhood or their teenage years or accidents or whatever there happened, then we need to use the Mind-Body Meridian remedies to help eliminate the causative memories and the effect that they have on the body. Now, you can just simply use the resistant desire process that's in my book if you don't know the neurophysical reprogramming. The neurophysical reprogramming would handle this in 1 to 2 visits at the most. In other words, all the causative memories could be permanently released when you do the neurophysical reprogramming. And I am having a class this year. It's going to be sometime in April. We're working on that now. So stay in touch with Bonnie at the California College of Natural Medicine. That number is 800-421-5027. And restoring hormone balance is key, because when hormone balance is and there's a stability there, then this helps bone density tremendously. We also need to rebuild the connective tissues. Now, the bones are held there by muscles, fascia, connective tissue, everything holds the bones in place. This is why we have to make sure our connective tissue, our muscles, are good, are healthy. So we want to look at how to do that. And we're going to be talking about some of the causes now. So if you have a patient with structural issues, you want to look at adrenal exhaustion. Do they have it? How is their dental situation? Sometimes people have loss of bone in their jaw. Okay, from root canals or mercury or whatever it's from something that has been done in the mouth, unless it's genetic. And if it's genetic, then you have to go after the emotional traumas and things like that. So we also have to look at digestive issues. If the person's not digesting minerals and nutrients, then we need to correct that with the Digest Pro. Adrenal exhaustion is handled with the BioAge Reverse and also with the ATP Max. Emotions, we want to look at belief systems and identities that cause absorption issues and many symptoms. So when a person has emotional issues, it actually affects the bone density and the digestive system. So we need to correct the digestive system in order to get the nutrients and the minerals out of food, first of all. And then I'm going to talk to you specifically about strengthening the bones, but you don't want to just do that. They'll be taking stuff for the rest of their life. You want to help them to fix their digestive system, to do all the things we're talking about. Endocrine dysfunction is another one. So we have adrenal exhaustion, dental, digestive issues, emotion, belief systems, identities, endocrine dysfunction. Environmental, including heavy metals, can affect bone density. Genetics, lifestyle and diet, medication suppress disease and cause the toxicity. It doesn't cure disease. A disease has never been cured, really, by a drug. It suppresses it so that it can come back later as something else. So if a person has a disease, a virus, or a bacteria, okay, and you give a drug, it is going, even though it seems like it may go away, then just track the next time they get sick and what it is. Sometimes it can come back worse, sometimes it comes back the same, or it migrates to another element in the 5-element theory of Chinese medicine. And then, of course, one of the other causes of structural issues is neurotransmitter and autonomic nervous system imbalance and physical trauma. Radiation, electromagnetic fields affect structural issues, and vaccines also affect structural issues. So we want to know these are the things that can affect it. So you've got to ask a lot of questions and be a good detective, because a lot of people have issues with bone density, and they're put on these very harsh drugs that do more harm than good, and we can do good without doing any harm. That's what we do. So the protocol is assessing the cause by developing and integrating a program from these tests that I'm going to give you. One is, of course, we want to get blood testing, but we want to use optimal reference ranges when doing it. And if you don't have my optimal reference range chart that you use with blood chemistry, then you can just call your account executive and ask them. Now, you need a blood chemistry. You need a comprehensive wellness panel. With it normally has calcium, magnesium, and all the things that are important. And then a complete urine analysis. And then a homocysteine and C-reactive protein test. And then also you should get a thyroid panel. And that incorporates free T3, free T4, TSH, which is thyroid stimulating hormone, and TPO, which is thyroid peroxidase. Now, the 5-element saliva test is important to assess endocrine system function. Plus, testing includes 5 cortisol testing times corresponding to Chinese 5 elements, organ, glands, and emotions. So the important thing about the 5-element saliva test, I developed this panel, and I have Diagnostic run it for me, and that my health providers can order the test if they have been to the neuroendocrine and anti-aging regulation training, or they are a licensed health provider. So this test indicates parasites, ova, and stool. The parasites and ova are determined by stool and saliva. So we're testing H. pylori, which is very, very hard to find in stool. You know, we test that by saliva. It also indicates all hormones, food intolerances, insulin level, gliadin, candida, and we also have the immune system. We're testing this secretory IgA, and we're testing DHEA besides all hormones, as I mentioned, including the 17-OH progesterone, which is only made in the adrenal glands, and all the estrogens, all free testosterone, and for men we have an amazing panel with androstenedione and dihydrotestosterone, and all of that is in one panel. You just need to mark male or female on it. So that is key for determining hormones. The blood chemistry is key in determining calcium, magnesium, bone density to some degree. We can see what the body's doing and some of the toxicity levels if you use the optimal reference range chart. And then we have hands-on, which is reproducible testing. It's neurophysical reprogramming or neurophysical testing. And as I said, you can sign up for that class at the California College of Natural Medicine. This will enable you to determine the cause of anything, including bone density issues. It's a hands-on residential technique. It's 4 days, and you have some online work to do, but we're having that sometime. I think we're going to be having it in April, and we're looking for the best retreat center to have it at. And so the cost of this training will include your room at a retreat center. So we are working on that right now. And this testing is the most important thing. This is a thing I count on over blood or anything else. I can always count on neurophysical testing to determine the cause of any condition. And I would love you to take this training because I feel that you will absolutely love it and you can leave it and go to work right away. So we want to also you to know that we have to investigate the patient's historical data, and I know I'm repeating this because it's so important. They can't just tell you they have bone density problems. You have to investigate it. You want to also test for and integrate all the testing data using a holistic model, mind, body, spirit. Now, if you take the neurophysical reprogramming, then you will learn about inherited and acquired toxins. You will be able to test them. You will be able to test pathogens, vaccinations, GMOs, everything. You'll be able to test all of it as far as a causative thing and be able to help them to release it. So we also need to understand that dental issues, as I said before, can be a big part of it, and all the other toxicities. So detoxification is essential of all filtering organs and then to monitor it. We have to eliminate pathogens that we find and all causative memories of historical events. We want to rebuild the connective tissue, the bones and the joints, using an integrative approach with orthomolecular nutrition, anionic minerals, organic diet, homeopathic biological medicine, along with herbology and epigenetics, working on their emotions as a definite consideration. By following this protocol and working on structural issues in hair, bone, skin, connective tissue, they will start to heal with detoxification and clean supplementation and ionic minerals according to testing. They need a dietary change, and every human being needs emotional release, no matter how much they insist that they have no emotions in their body. That would be the one I would go after first. So let's look at estrogen. This is important for hair, skin, bones, and emotions. If your bones don't have enough of necessary hormones in the right ratio, it can actually hurt the structure in the bones. Now, if you have too much estrogen because you've been on hormones, that it's even worse than being deficient in it. So the estrogen actions and what it does with bones are really complex. The major physiological effect of estrogen is to inhibit bone reabsorption, or resorption, rather. So bone cells have two kinds of intracellular steroid receptors for estrogen. When estrogen binds to the receptors, various genes become active. Estrogen also has effects that don't depend on activating the DNA. So the effects of estrogen may be mediated in part by growth factors and interleukins. For example, interleukin-6 is a potent stimulator of bone resorption, and estrogen blocks the osteoclast synthesis of interleukin-6. So estrogen may also antagonize the interleukin-6 receptors. So transgenic mice, has been recorded in research, without interleukin-6 do not develop osteoporosis after an oophorectomy. Oophorectomy is taking the ovaries out, having surgery. So we have to also know there's certain things that you can give anyone to help bone density and help hormones. So as you're helping hormones using NuFem hormone rejuvenation, and I highly recommend the female hormone rejuvenation kit, whether you do a saliva test or not, this will help most imbalances in hormones very quickly because it includes everything that a person needs. And I put this kit together. So it works on everyone, and I think you can feel very safe in using it. That's why I created it. Now, regarding hormones, we're going to go back to hormones, and where we left off just a second ago was on estrogens, and now we're going to go to osteoclast apoptosis, which is regulated by estrogens. With estrogen deficiency, the osteoclasts live longer and are therefore able to resorb more bone. Now, in response to increased bone resorption, there is increased bone formation and a high turnover state develops, which leads to bone loss and perforation of the trabecular plates. Now, estrogen has multiple other effects that relate to the skeleton. For example, enhanced intestinal calcium absorption can be beneficial to bones. Estrogen protects the bone from the resorptive effect of PTH, and estrogens may interact with mechanical forces to build bone. Now, there are different effects on the endocortical surfaces and the periosteal surfaces that result in different shapes of bones in men compared to women. So we have to look at estrogen and calcium connection. This is very important. And one would think after this that you want to pump the body with estrogen, but as soon as you cause the ratios of the progesterone, estrogen, and testosterone to be out of balance, you're doing major toxicity and harm to the body because of the estrogen and calcium connection. Their involvement with bone health is central to the relationship between estrogen and calcium, meaning that you have to maintain an appropriate level of calcium, not too much, and you need some. You need some, but you don't want to be too decreased, and you definitely don't want to be elevated. Okay, maintaining an appropriate level of calcium is important not only for bone growth over time, but also protecting bone strength. Estrogen supports this activity by aiding in intestinal absorption of calcium. If your digestion isn't working, you're not going to absorb it. That's why you need to see if there are any parasites in the body that would affect digestion. and use the Digest Pro. And the way that you test for parasites, the best way that I know of in my life of anything I could use would be that 5-element saliva test, the 5-element FIPP. In one test at one time from a patient, you get everything tested at once. This makes it accurate. You're not testing hormones 1 week and then parasites 2 weeks later. You're doing everything in one panel, which gives you a very accurate blueprint of what's going on. So estrogen supports the activity by aiding in intestinal absorption of calcium. If the digestion is not working correctly, and if you're not absorbing it, this is not good. So having low estrogen, way too low levels, negatively impacts your body's ability to make use of calcium you consume. This in part explains where you are at more risk for osteoporosis if you're female. So, and this is according to Dr. Marjorie Gass, G-A-S, of the University of Cincinnati. So Dr. Marjorie Gass points out really that women with conditions affecting their estrogen levels, such as early menopause, are at risk for bone loss. Now, we have to look at how to fix the bones. So let's say the person has osteoporosis. We're not going to let it stay like that. We have to do everything we can, including testing the hormones, or instead just using the female hormone rejuvenation kit for 3 months. It's going to take 3 months, okay? And after 3 months, they can go get another bone test. That's what they should do. Let me talk to you about ionic minerals, because ionic minerals are key in fixing this. Ionic minerals are very important because of the ionic nature. So an ion is any atom or group of atoms that holds one or more positive or negative electrical charge. Now, positively charged ions are known as cations, while negatively charged ions are called anions. Ions are formed by the addition of electrons to, or the removal of electrons from, neutral atoms or molecules or other ions. So this gets very technical, but I want to tell you that the splitting of the bond between two atoms, such as a portion of the electron shared by the previously joined atoms, are split between the two now individual atoms. Now, examples of this include the reaction between a sodium atom and a chlorine atom to form sodium chloride, now comprised of a sodium cation and a chloride anion. That's spelled A-N-I-O-N, anion. So some important cations for human health are calcium, hydrogen, magnesium, sodium, and potassium, while important anions, A-N-I-O-N-S, are bicarbonate, chloride, and phosphate, to name a few. So we have to think about the body having ionic minerals that assist the bones in the entire body, the skin, the hair, everything. And those would be calcium, hydrogen, magnesium, sodium, potassium, and then also have the anions, which are bicarbonate, chloride, and phosphate, just to name a few. So ionic minerals are the only way to get the minerals into the bone. There is no way that taking calcium is going to put it into the bone, but you will create some very attractive kidney stones from taking calcium supplements. I work at getting all of my patients off of calcium supplements because it is very harmful, and actually in Germany, they don't allow people, just the general public, to go buy calcium because it's so proven that it causes kidney stones. Yet in the United States, people are buying it and taking 1,200 milligrams of calcium a day. It does not go into the bones that way. It goes into the bones if you use the ions, the ionic minerals. There's no toxic side effects. You can't create kidney stones, and it actually helps strengthen the bones. Now, without calcium, and the right kind of calcium, you can't rebuild new bones during the lifelong process we have of bone remodeling. You know, bones are the reservoir for two minerals, calcium and phosphorus. You need a constant level of calcium in your blood since many of your organs, especially your heart muscles and nerves, depend on calcium. Now, when these organs demand calcium, they'll steal it from the mineral storehouse in your bones. Now, over time, as you deplete these mineral reservoirs in your bones, you end up with thin, brittle bones. Calcium is one of the most important minerals in the body, but you need to get it in the ionic form or you're going to have kidney stones. Okay? Every day, this is what it does. And the majority of it is found in your teeth and your bones, but it also involves muscle function, blood clotting, and nerve function. And if you take it ionically, it will work better, quicker than any other form that you can take it in. So I know as a naturopath myself, I'm very interested in helping people without causing more harm. Now, with calcium, you can get a considerable amount from your food, but because of our digestion issues, our stress, which sometimes affects our gut, and parasites, we don't absorb enough of calcium from our foods. Especially we're eating junk food and all kinds of fast food products. Now, you can get a lot of calcium from dairy products, but they're allergenic and inflammatory. You can also get calcium from nuts and dark leafy greens. Now, in some cases, your doctor may recommend a supplement to increase your calcium level, but you really don't want to do it that way. You want to do it with ionic minerals. Now, increased calcium from supplements definitely cause kidney stones. It's all over the internet. You can look it up and you can find out the reality. But I have done that all for you because this is what I do all day long. So the type of calcium is critical. So ionic minerals are cell-ready. You need the calcium supplementation. You need you need a supplement that has all of it in there. So I have the nanoionic multiple mineral with silica. So it has calcium. It has everything you need in it as a very balanced mineral supplement. It's called nanoionic multi with silica. Now, research indicates that calcium supplementation it has many other problems as well, and you need to be very, very careful about that. So, surprisingly, the more calcium-containing foods you eat, the lower your risk of kidney stones. See, this was confirmed during a study involving 91,731 nurses between the ages of 34 and 59, none of whom ever had kidney stones on the outset. During the 12 years of the study, 864 of the nurses developed kidney stones for the first time. That averages out to about 1 of every 1,000 that were participating. The researchers found that the higher the intake of dietary calcium, the less chance of the nurses had of developing stones. However, among the nurses whose calcium intake was high, who took calcium supplements, the risk of developing kidney stones was 20% greater than normal. So, and I say that it's even higher than that because today we constantly have supplements and they think people will buy it if it's a higher potency. And they're all over the health food stores. You have to be very, very careful about that. Phosphorus is a mineral found in your bones along with calcium. Phosphorus is needed to build strong, healthy bones as well, keeping all other parts of your body healthy. Now, normal working kidneys can remove extra phosphorus in your blood. So, normal working kidneys can remove extra phosphorus in your blood. Now, when you have chronic kidney disease, which is the acronym is CKD, your kidneys can't remove phosphorus very well, and high phosphorus levels can cause damage to your body. This is why you want it to be in an ionic form, because it's cell-ready. Extra phosphorus actually causes body changes that pull calcium out of your bones, making them weak. High phosphorus and calcium levels also lead to dangerous calcium deposits in the blood vessels, lungs, eyes, and heart. Phosphorus and calcium controls are very important for your overall health. You want to get people off of dairy products, and I find the best diet for people is vegan. The sicker they are, the more they need vegan, completely vegan. And they will start feeling better in a few days. They will feel a difference. Now, the only minerals, as I said, the nanoionic multi is one product, and it has everything we need in it. But in addition to that, I would also use silica, the nanoionic silica. I would also use the nanoionic bone, and and then I want to just tell you that very briefly that the homeostasis of calcium and phosphorus is the result of complex relationships between calcemia, phosphatemia, and different hormones and factors working synergistically to keep a normal balance of these minerals. Well, synergistically just doesn't happen today because of the junk food, because of all the fast food, because of all the meat that people are consuming. There's no synergistically without you. You make it synergistically. See, you do that. Now, as far as minerals, other minerals needed by bones are boron. We need boron. Boron is in the nanoionic multi with silica, and you need that for calcium absorption, and we have it ionic. Although all of the deficiency symptoms of boron are not fully understood, it is known that, boron deficiency might result in the abnormal metabolism of calcium and magnesium. So you have to have boron. Boron is a mineral that's found in food and the environment. People take boron supplements as medicine. Boron is used for building strong bones and treating osteoarthritis, but you want to use it. You want to use it in an ionic form, or you're going to get too much of it and it's going to become toxic, and that's what we found over and over again. So boron is used also for increasing testosterone levels. So if someone has low testosterone levels, man or woman, it could be that they just need the nanoionic multi with silica, okay? And also boron is used for improving thinking skills and muscle coordination. Aches and pains in muscles are quickly relieved by raw nattokinase and ionic magnesium, calcium, and the nanoionic multi, which has all of those things in it except for the raw nattokinase. It's a supplement in a bottle. It's vegetarian, veggie caps, real clean. It's made from food, and wow, does it work for pain and muscles and ache. It's immediate. Like you take 2 pills, you wait a couple of minutes, and you start feeling the difference. So, and it's safe for anybody. For women with low estrogen, particularly those going through menopause, hormone replacement therapy has been a controversial treatment method. Research appearing in 2004 in obstetrics and gynecology revealed that wearing a low-dose estrogen patch significantly increased bone mineral density in older women's hips and spine. However, it's unclear how safe long-term use of this, obviously because of the Women's Health Initiative proving in all of the people who were taking the patch and hormones and the pro-estrogen and whatever, all the different ones they were taking, that it was proving health risks like cardiovascular disease, blood clots, heart attacks, and cancer, and that is a fact. So they had to stop the study. They had 5,000 women in there in that study. So we need to look at a couple of things here regarding some other minerals. The causes of osteoporosis, other than estrogen, several other hormones play a role in regulating your bone density, including parathyroid hormone and growth hormones. So they help orchestrate how well your bones use calcium and when to build up and break down bone, right? Excuse me. So growth hormones. We have the bio-age reverse. Excuse me. So that's what happens when you talk too much and you start swallowing too fast. So the growth hormone, the BioAge Reverse, helps with this, and tremendously. And that's what it's used to help the body, to re-educate the body in making their own growth hormones naturally. It's very safe for anyone to take. It's at a higher potency, meaning that there's less substance in it and it's much more gentle on the body. However, with parathyroid hormones, if anybody takes that, there is really a downside to that. Too much parathyroid hormone, called hyperparathyroidism, causes calcium loss in the urine and at the expense of the bones. So less calcium means weaker bones, and as you age, your body produces less growth hormone, which you need to build strong bones. So the BioAge Reverse would help to re-educate your body, not to stimulate. Stimulation means it's making the body do something. This is not making the body. This is reminding your body and the parathyroid gland that it's healthy and encouraging it to make its own. Okay? And that's what you want to do. You never want to give hormones to anyone, including DHEA. You want to make sure it's all homeopathic, and you make sure that person doesn't drink any caffeine or anything with caffeine in it. Now, we have to also look at low testosterone in men, because that can be related to osteoporosis. Men need both testosterone and estrogen. They need the estrone for bone growth and estradiol. They manufacture those. And that's because men convert testosterone into bone-preserving estrogen. Now, there's a clear consensus that when you're evaluating men with osteoporosis, you always evaluate for testosterone deficiency. However, my saliva test for men includes all hormones, including the estrogens and progesterone, in addition to, of course, the testosterones. So both bone loss accelerates after menopause, but when older women have a quick drop in estrogen, over time, the risk of osteoporosis and fracture increases as older women lose more bone than they replace. We can fix that. We can work with that. Younger women who stop menstruating, such as thin athletes or girls with anorexia, also have compromised bone density, says the U.S. Surgeon General's latest report. It's called Bone Health and Osteoporosis. You know, having both ovaries surgically removed, it's called a bilateral oophorectomy, may also cause osteoporosis and low bone density. Now, in one study, the surgery caused a 54% increase in hip, spine, and wrist fractures in a postmenopausal woman. Now, we got to help these people that come in who have had these things, and we also need to know that vitamin D is very important. Vitamin D, too little of vitamin D, can lead to weak bones and increased bone loss. Active vitamin D, also called calcitriol, is more like a hormone than a vitamin, actually. Among its many benefits, vitamin D helps your body to absorb and use calcium. Sedentary life is not good for bones. Bones weaken if they aren't worked. And remember that, the early astronauts, they suffered rapid bone loss from being weightless in space. For people who are sedentary or having a condition like paralysis or muscular dystrophy, bone loss happens quickly because you're not moving. You need to move. As a cause of osteoporosis, this one's in your hands. You can help remodel your bones with weight-bearing exercise where you're putting gentle stress on your bones. So you go to the gym and you have the light weights, or you have a physical trainer and you do the light weights, and you need weight-bearing exercise. Bones need that. Thyroid conditions is another issue here in osteoporosis. See, high levels of thyroid hormones have long been linked to an increase in bone loss. Your thyroid hormones should be normal. They should be within a certain reference range. So that's why the thyroid testing is so very important. If you go to Direct Labs on my website, you can order for yourself or for your patient, but your patient has to fill out the form and pay for it themselves. You can test and use the Dale panel to test those 4 thyroid hormones. So this high levels of thyroid hormone has always been a concern of many, many physicians. But if you look at the long-term bone densities of patients who are on high dosages of thyroid pills, they're not dramatically different, and their fracture risk is still bad. It isn't dramatically different. So when you're on thyroid pills and it's too high, you're taking too much, and when you do the testing, you can see that this can also be a problem. It's not just naturally high levels of thyroid, but also when you're taking a medication that increased thyroxine and all the hormones and the T3 and whatever hormones they're giving you will increase bone loss. Smoking cigarettes, not only will it kill you, but it'll also cause bone loss and increase bone density, besides all of the other things. So medications, taking certain meds may lead to bone loss and increase in bone fractures. Most common are corticosteroids, also known as cortisone, prednisone, will destroy your bones. Okay, hydrocortisone, same thing, glucocorticoids, and prednisone, as I mentioned. Now, these drugs are used to treat so many things, from asthma, rheumatoid arthritis, psoriasis, colitis, and a wide range of other conditions. Anti-seizure drugs are linked to bone loss as well. So if your patient's on anti-seizure drugs, then you have to, if you're a medical doctor, then you have to work on getting them on a good program, and perhaps look at CBD. If you're in a state where you're allowed or can send them to a cannabis doctor to get CBD, which is the cannabinoids that do not make you high, but instead they have tremendous research about stopping seizures. But you have to send your patient to a cannabis medical doctor, depending upon the state that you're in. But anti-seizure drugs are linked to severe bone loss. Now, medical conditions, like a host of medical conditions, can lead to bone loss, from genetic diseases like cystic fibrosis to digestive diseases, to tumors called multiple myelomas, which infiltrate bones with abnormal cells. Abnormal calcium excretion also contributes to bone loss, but some people just don't trap calcium like they should, and they excrete it through the urine at the expense of the bone. Caffeine does that. Caffeine can actually have a detrimental effect on eliminating minerals. It will just come out in your urine. It will cause minerals to come out, even much more than they should, okay, because caffeine is a diuretic, isn't it? All right, so we're looking at taking certain medications that may lead to bone loss and increase bone fracture. And we also need to understand that the vitamins and minerals that are necessary, we're not quite complete with that. We're almost complete with this. But too much alcohol is another thing. Alcohol can arrest bone remodeling. Arrest means stop, halt, bone remodeling, and increase your calcium loss. Being tipsy increases the risk of falling. And with osteoporosis, that means you're risking a fracture as well. The good news in all this is your bone health is largely in your control. You can talk to your patients and tell them it's largely in their control. They have to make new choices and new decisions about their body. Too much animal protein. An acid-ash diet is a diet that creates acid in the process of its metabolism. The average American diet, which is high in protein and low in fruits and vegetables, can generate just an overdosage of acid daily, mainly as phosphate and sulfate. So acid generated by a diet is excreted in the urine. Foods such as fish and meat have high potential renal acid load opportunities. Many grain products and cheeses also have a high PRAL, and that is the potential renal acid load. Now, in contrast to this, milk and non-cheese dairy products such as yogurt have a low PRAL. Fruits and vegetables have a negative PRL, which means that they supply alkali ash to the body. So this is all, I know, a little bit complicated, but we have to understand that we need to discuss these things with the patient. Now, even if it's too much animal protein, people are doing paleo these days. Do they know what they're doing? Okay? Although protein is very important to the body, we have to also understand that hereditary exercise and dietary calcium and phosphate per se is also very important, because the factors discussed herein are not related to sex hormones. Findings apply equally to both genders. So too much animal protein can actually create that acid ash and cause too much calcium and other minerals, not just calcium, but other minerals to come out of the body. So we want to talk about the silica right now. The silica is very important, and the boron is very important. Silica is amazing for your body, your tissues, your hair, your skin, and for your muscles and your fascia and your heart. And your muscles have to be very strong to hold your bones in place, right? So the high protein content of Western diets is often cited as a risk factor for osteoporosis or bone fracture. I would get all people off of animal protein, and that's what I do when I speak with people, and that's what I do myself once in a while. Personally, I might have a little bit of chicken. I mean, it might be at the most once a week, and maybe a little bit of eggs once or twice a week, and that's it. The rest of it is veggies. And I just had my I just had a life screening test, and and also a blood test. So I had a life screening test for osteoporosis, as well as all of your arteries and veins and everything. And my bone test is perfect. It wasn't osteo or osteopenia or anything. It was perfect. And so this is because I'm absorbing my food that I eat, and I eat good foods, and I do work to handle stress that I have, that we have in business or in life. Now, high protein intakes have been shown to affect calcium homeostasis, resulting in increased calcium excretion. And sometimes if you do the protein, and if you're doing as well caffeine, and you're doing a number of different things, you can have really increased calcium excretion. But findings regarding the effect of protein on calcium balance and bone health have been mixed. One study of 191 nuns who were studied over a 20-year period found that protein intakers ranged from, or protein intakes ranged from 0.41 to 1.96 kilograms, and it had no effect on calcium absorption efficiency. But, this is a group of people that was done that really do not work too much, and that really have a way of handling stress through prayer. So there's a lot of things to consider with all of these results that I have looked at. And we want to also talk about the effects of vitamin D is important. The exercise is very important. And there's another thing that I really want to talk about, and I have a lot of information on animal and bone health, And basically I put it into a nutshell for you, but I think there's something interesting here. There are many factors that influence bone mass, but protein has been identified as being both detrimental and beneficial to bone health, depending upon a variety of factors, including the level of protein in the diet, the protein source, calcium intake, weight loss, and the acid-base balance of the diet. Remember that protein intake affects bones in several ways. It provides the structural matrix of the bone. It optimizes IGF-1 levels, and it is reported to increase urinary calcium, and it is reported to increase intestinal calcium absorption. So this information was taken of people who are eating very little protein, little bit of protein. And that animal protein could be substituted for pea protein, organic pea protein, for organic hemp protein. Those are the two protein powders that I like the best. I like hemp better if it's pure hemp, better than pea. Only pea protein, PEA protein, is higher protein per serving. So, and it's a lot of people digest it well. It just depends on the person and how their digestive system is. Now, minerals for women with low estrogen, particularly those going through menopause, we have to understand that minerals are essential to the body. Now, endocrine disruptors, as we're looking at endocrine disruptors, we can see many different things in the body. One of them is stress, phthalates, bisphenol A, other phenols, heavy metals, dental, vaccination, sensitivity, medications including hormone replacement, environmental chemicals including household cleaning products, meat with hormones, antibiotics not organically raised, pesticides, and radiation. And we have to understand that if we give our patients if we don't get them off of hormones, here's what happens. If they're on hormone replacement, it causes the body to shut down production of its own natural hormones because it completely dysregulates the circadian rhythm. The circadian rhythm produces naturally hormones at different times of the day and the evening. Throughout the day, it's producing different hormones naturally. When you give the body a hormone, the circadian rhythm gets confused and basically doesn't know what to do because it's going to pull back what it was going to do, and the whole circadian rhythm is going to be adjusted. So you're really causing the body to shut down production of its own natural hormones. It's causing the dependency, aging the body, a toxic burden to the entire body, including the liver, kidney, blood, and the immune system, as well as causing inflammation and toxic levels of hormones and toxicity that is within not just the liver, but throughout the system and the blood. So, and it also causes stress because the circadian rhythm is actually affecting the health of the adrenal glands. So we want to look at silica, boron. We want to look at also all of homeopathic remedies are very, very healthy, some of them for bones. We want to look at homeopathy for hair and muscles. I've got those in my hair stem, and we have the muscles handled with the raw natto kinase. We want to also know that to help the dental health, we need, if there's a dental issue where we have bone bacteria, we can use the ionic mineral that I developed. It's called super silver, and you spray that in the mouth. We can do that for any infections, including canker sores. So bone is very important. Okay, and we have to check the jaw. We have to check everything. We have to get them on the vitamin D3. I would also get a person on the nanoionic multi with silica, the extra silica. I have a bottle of just silica, the best silica there is in the world. It is so clean. And then the nanoionic bone. That's what I would do. Also, you want to consider testing them for iodine. They definitely need vitamin D3. Okay, and the other things that we mentioned. So if you have any questions, please ask them now. Just press *5. Very good. Well, thank you so much for listening tonight, and hopefully the recording will work out fine. And if you need to give us a call tomorrow, our number is 866-962-6484. And Kenneth is going to be on duty tomorrow, so he is going to be at extension 2. And you can always give him a shout out. He's terrific, and I hope that you get everything that you need in order to help your patients. If you do need any help, you can always give us a call, especially if you're a member. If you're a member, then actually you can discuss all of your patients' cases with me, and if you'd like my help, I'd be happy to be on your team. Many blessings. Bye-bye.